Nexus Motion presents The Way of Movement Professionals, conversations with world-class physical therapists and other industry experts.
Hi guys, this is Maiko from Nexus Motion. Welcome back to The Way of Movement Professionals, where I get to sit down with physical therapists and through our conversations, find out what makes them world-class. So today, I have the honor of introducing to you Dr. Nancy Bloom. Nancy is a professor of physical therapy and orthopedic surgery at the program in physical therapy at Washington University in St. Louis. I've been lucky to be one of her students during my time at WashU, and I continue to learn from her since I keep bugging her with all of my clinical questions about as it relates to the hip or any of her research findings on the chronic hip pain population. So Nancy is currently serving as the Education Committee Chair for the Academy of Orthopaedic Physical Therapy, also formerly known as the Orthopaedic Section.
Right.
Yes. And for many decades, she has taught nationally and internationally on the topics of the diagnosis and treatment for the movement system impairment syndromes. So thank you so much for being here, Nancy. And I'm really excited to do this interview and having this conversation so we get to know you a lot more in depth professionally and also on a personal level too. So,
Okay.
Yeah. So we'll get right into the questions. There's a little backstory because Nancy, can you tell us what you were doing before you became a physical therapist?
Well, other than just growing up in St. Louis and having a kind of a normal child life, I received my master's in OT and here at WashU, and then I worked my first job I was focused on neuroscience.
Yeah.
So I had my first job in neurology.
Yeah.
And that's where I got my start.
Excellent, excellent. And then from then on, so you were an occupational therapist first. What led you to choose that physical therapy path?
Well, when I was in occupational therapy school, they had just started a master's program, so some of my coursework was more for the baccalaureate for OT at the beginning, and so there were foundational kind of courses, and Shirley Sauerman was teaching the kinesiology for the occupational therapists, and so I was intrigued by her lectures, and I already had a college degree, so I kind of was looking for more than just memorizing something. So this was a course that made me think, and I think that's why I got so interested in movement early on.
She has a way of doing that.
Yes. And so I took my first job in neurology and neurosurgery because Shirley had an appointment in the Department of Neurology.
I see.
And so then Steve Rose came along, and Shirley and I were collaborating. She helped me with my master's thesis in OT.
Okay.
And so then Steve came, and they just said, Nancy, would you like your degree in PT? You act like a PT and think like a PT. And so I was very fortunate that they created a path for me.
That's great. So it's all kind of in that flow journey.
I think, another thing that I was frustrated with in occupational therapy was that I would discover musculoskeletal problems in my neurology patients, shoulder pain or hip pain or whatever, and I just didn't really know how to manage it.
I see.
So I knew there was an issue with the way they were moving and it hurt, but I really didn't have the training to really analyze it. So I think that was one of the things. And another key moment was I had submitted an abstract to the OT national meeting on muscle tone in stroke patients and their triceps, and it was part of my master's work. And it was turned down because they said it was too scientific.
That was the feedback. I didn't know they could do that.
That's what they said. And so I submitted it to the physical therapy conference, and it was accepted. So it was kind of like, maybe just what I'm doing is more in line with the physical therapy profession.
I see. Okay. So when you first started seeing patients, what type of patient population were you working with?
I was working here in St. Louis at Irene Walter Johnson in outpatient orthopedics. So it was a real mix of all the typical things you see in outpatient orthopedics.
Okay, I understand. And currently, what subjects do you teach at the program in physical therapy?
That's an interesting question. I was thinking about that. I probably am involved with 11 courses.
11?
Yes.
Yeah.
So I course master some, but then, we all teach in each other's courses. So it's probably better to say I'm involved with the hip content, starting with anatomy, and then kinesiology, and then the diagnosis and treatment, and then sometimes some specialty subjects.
Okay.
So I kind of take the thread of the hip through the curriculum, and none of those are my courses.
Okay.
And then
yes.
the courses I'm course master for are more integrative, so case integration is one of the names, so trying to pull from all the courses that the students have had at that point in time and collect information and do some clinical reasoning and reflection on cases. And then the other big thing that I'm involved with series-wise is called, very exciting, Diagnosis and Evidence Analysis.
Yes.
And everybody kind of rolls their eyes when you hear the word matrix, but it is useful.
It sure is.
And I was just helping a student in my office the other day trying to figure out about her job. I said, why don't you make a little matrix, the pros and the cons? She laughed, but she said, I think I might do that.
Yeah.
But anyway, because we're evidence-based practitioners, or at least trying to be, I teach the evolution of how one looks at the literature and synthesizes it to answer clinical questions. So that's across 3 different courses.
Wow.
So that's mainly what I teach.
Great. And you mentioned a lot about the hip, and in my eyes, you've always been my hip lady. Right? But how did you become so interested in the hip joint, and now you're so involved with the hip research team here at Washington University, including some physicians as well?
Yeah, I think it all started when I got asked to teach anatomy of the hip. And I really dug into the anatomy and read a lot. And it was pretty fascinating because of things I didn't know. And I began to become aware of structural variation and femoral versions and how development and how it all changes. And so I became more knowledgeable from the anatomy side. And then I began to really examine my patients with a new eye. And then it just kind of took off, and actually Shirley Sauerman was very interested in the hip as well, just kind of recognizing the interaction between all your lumbar spine patients and your hip patients.
That's right. You can't separate those two.
Right, and so I just got more and more interested, and then younger people started having hip pain. Then what you learned in the old days was it just goes bad eventually, arthritis. But now there's all kinds of subtle movement impairments, and I was actually looking in my CV, and I think in 1980, Shirley and I had a poster on hip impingement, and we called it hip impingement.
Wow.
Yeah.
Way ahead of the time.
Looking at that little micro instability way back then.
Yes,
Yeah.
because now you find so many articles published by the minute on FAI.
That's right.
Yeah.
That's right.
Yeah, but back in 1980.
Yeah. We were just dinosaurs.
That's awesome. Now, in 2002, which is the year that I actually started here at Wash UPT, you received your Doctor of Physical Therapy degree. Now, you already have so many credentials. Why was it important for you to pursue that?
I think I always wanted to get my doctorate, and when I first finished getting my credentials for PT, there was an opportunity perhaps to get my PhD in neuroscience, and I just felt like I needed time to see patients because I felt like I didn't want to do full research. I wanted to treat patients, and I felt like I needed to get my feet wet with what the world was really like and get out of academics and then maybe go back and get my degree later. So that's kind of was my decision, and I kept hearing about this doctor of physical therapy impending, but it just didn't come, and it didn't come, but we kept working on making it happen, and it finally did. And so really that was the direction the profession was going, and I preferred that as a degree because of the clinical aspect of it. So that's why I pursued it.
That's great. Now, you've been involved in the American Physical Therapy Association, and particularly in the Academy of Orthopaedic Physical Therapy. Could you maybe share some of your most memorable achievements with your involvement with them?
Well, I think I don't know that I have big achievements, but I am contributing. One APTA thing that I've done recently that I was honored to be involved with is a task force on diagnosis for the movement system. So I went to Alexandria and with a bunch of other individuals, and we kind of try to create a template for a movement system diagnosis, and so that's being looked at right now. So I think therapists will be getting an opportunity to fill that template out soon. So that was exciting. And then the role as education chair is, my job is kind of twofold. One is to plan all the programming for combined sections meeting. I didn't really know that when I first got involved.
Okay.
So I have worked hard to try to make the programming in orthopedics at CSM better and better. And so usually there's 105 or so abstracts that you have to review, and you have room for about 25, 26, 20.
Wow. Okay.
Yeah. So you really have, I have a committee.
Yes.
So it's pretty labor intensive in terms of reading all of that and narrowing it down.
Just a mere 100 or so.
Yeah. So that's exciting. And then the Orthopaedic Section's also been trying to have an annual meeting, and it's relatively new, and kind of happened right as I became chair. And so that's kind of fallen in my lap, and so we've been trying to get that off the ground. Hopefully,
I think you guys have been putting together great programs for the Orthopedic Annual Conference.
Yeah, they are great programs, but they're small.
Yes.
And so, and it seems like people don't know about that, so maybe this will help.
That's right,
tell
you
the
guys.
world.
So there's one happening in April.
That's right.
In Denver. I'm actually looking forward to attending
good.
that one, and particularly learning more about the blood flow restriction type of stuff too. But there's so many more great programmings coming in that.
Yeah. So, and I, as an ed chairperson, I sit on the board. So I actually am in every board meeting, and so I feel like I have a voice. And most recently, there's a bill out, or not a bill, I guess it's a bylaw change, to allow the chair of practice, education, and research have a vote at the board meetings.
Okay.
So right now we're just kind of advisors.
I see.
And so probably, depending on what the vote is, we may be voting members soon.
Great. And how many people are in the education committee? You work with a team of people to go through
About
some of the
7.
abstracts. Okay.
Yeah.
Wow.
Yeah, I have one vice chair, Manny Young, right now,
Okay.
and then 5 or so. It depends, but that's about the average. Is about 7 people. So that everybody grades all of the abstracts, so that there's no bias. And if you know somebody, you can't grade it.
Right.
So you just have to. You can comment like, I think this would be a good program, but you're great. You don't really get to vote on it.
It's more coming from a neutral
Right.
standpoint. That
Right.
makes sense.
Right.
Okay. So you do so many things. Of course, you see patients in the clinic. You have your 11 courses that you're involved with teaching our students here. And then you're also involved with the hip research. How do you balance all of those in your time and balance it with your family as well?
That's a good question.
I would like to learn
Yeah.
that. I
Lack
don't
of
have
sleep.
research involvement going on, but
Really, I do think it's important to balance time for your family, because I'm a real family person. So, I guess I work many hours. It's hard to say. It is a balance act. And sometimes it just shifts. Like, we're really intensely involved in a deadline. And so your family suffers a little in those times. But that's, it's still your priority. So as soon as things calm, you shift. So across the year, it probably is more balanced than it is on any given day.
Do you guys like pencil in, okay, this is our fun day together, that's set on the calendar type of thing?
Sometimes. We don't ever have lunch breaks, because there are always meetings and things like that.
Sure.
So we do meet as a group for the movement system impairment group once a month at 5 o'clock to 7, because nobody ever has time at the same time free.
Okay.
So we do that, and that's fun.
Sure.
I mean, we get to talk about things, but it's also a time when we're together that isn't so jam-packed with responsibility.
Right. Now, moving on to overall, your perspective on physical therapy, we'll start with, what are some concerns you've encountered as a PT?
I think one of my biggest concerns is the variability in practice. And that a person can go to 3 different physical therapists for the same problem and get 3 completely different treatments.
Sure.
And so that bothers me. And I feel like I often get patients who have been to many physical therapists. By the time they get to me, they're like, well, I've done this before. They kind of already have an attitude problem. And I find out what they've been doing, and it's upsetting to me, because I don't think they did an exam, a thorough exam, because if they did, they wouldn't prescribe that particular exercise or whatever. So I think we need to improve our evidence-based practice, but also just consistency of how we approach the patient and the basics of what we do. So there's not so many variables.
And you think the issue is that there's not a standardized examination that everybody across the board is performing, so we're just sort of all over the place.
Right.
And probably not using a lot of the same movement diagnosis, so we're not really speaking in the same language, even though we're all called physical therapists.
Right, and just the name alone sort of implies that you're going to do something physical, and it's therapeutic, as opposed to figuring out the problem.
That's right.
I think we need to figure out the problem and let the patient know that you've come to me today, I'm going to figure out what I think your problem is, and hopefully educate you on what that is, so you take control of the problem. And I feel like that's just a shift in us taking leadership in that alliance, as opposed to a bag of tricks where we're going to do a lot of things to you, as opposed to figuring it out so that whatever we do is more focused.
Yes, absolutely.
So that's probably where I think we're moving, but slowly.
Okay. So now the next question is, we've already talked about your concern about physical therapy. What gets you really excited about being a physical therapist, the positive side of things?
Well, I really enjoy working with people. I love teaching students as well as my patients. And I really do enjoy figuring things out. And I feel like that just sets up such a good relationship with the patient. And if I don't know what the problem is, I feel like I will reach out to others to help. So I really get a kick out of working with patients, trying to help figure things out and help them get better.
Yes.
And not everybody gets better, and that's kind of what I think our students need to learn is, we have this idea that we graduate, we're going to make everybody better. But a lot of what we do is manage a problem and keep it from getting, minimize the deficits from that problem, because if some patients can't improve on some things, and so you're really kind of, this is that lifespan practitioner kind of thing. I've had many patients for over 20 years, and you're just kind of managing things as they go along, and sometimes it's not always making them better as much as it is minimizing the difficulty in helping them perform.
That's right. Just slow down the degenerative changes, some of the changes
Right.
that they're going to have to face in life.
Right. It's not always good news. Like, I want to be doing this every day. Well, maybe think about the load that you're putting on your bones, your joints, and you only, you can only take so much of that. So you have to spread it out, that kind of stuff.
Yeah.
So it's not always, take my pain away as much as you're managing
Right.
situations.
And as far as being that figure-outer person too, I think you're in a perfect environment where all of the faculty here, you guys always have that discussion. That once a month meeting with the MSI group, or all of these discussions. They're like, what do you think? Why do you think this is going on? And there's so much information exchange going on. I'm sure that's a very good, stimulating environment to be in, and you continue to grow.
Absolutely.
Yeah.
I think if you're also in an environment where you're teaching and seeing patients, you know that you have to stay current with what's going on, and then you also need to apply what's current to your patients. So you're teaching what's current, you're trying to move your practice in that direction as well.
Yeah.
And being surrounded by people who are like-minded, you can just grab somebody and say, I'd like you to take a look with me and see if you have any additional ideas, or
Yes.
once in a while, even now I get patients have a condition I have not ever seen before. So you think, okay, I can do this, and you just have to learn a little bit about it, but grab someone who might know more about it.
Yeah. And I think, what do you think, is it so important that the faculty actually has the practice, the clinical practice downstairs? I so appreciate it being taught from teachers who are seeing patients at the same time, that there's this real life experience in that story. Not, of course, evidence is important as well, and we could read into research articles, but the real life tips, and these are the patterns that we see in the clinic. I think that was so valuable too.
Good. Yeah, I think one of the parts about evidence-based practice, though, is clinical expertise. So you match the patient's values and what you know about the literature and your experience, and you put that together to give your patient the best treatment.
Yes.
So there is a component of that, for sure, even though we don't have proof. If we needed proof for everything we do, we'd be stuck.
We wouldn't be able to do a thing.
Right.
Well, I'm a little relieved to hear that you still encounter patterns or things that you haven't seen before, or we think, okay, I have 10 plus years of clinical experience now, and I still struggle many days. It's like, I'm not sure, if I'm seeing this correctly, if I got this right, and I'm glad that you're still thinking things through and have some moments.
Right, and I think even if you've not seen a condition before, if you have your standard approach to your examination, that's a good start. And then the impact that condition has on the movement or the findings, maybe that takes a little learning curve, and how you dose your exercises for that person or your training.
Sure.
So, but yeah, no, I continually get new events.
All right, so moving on to, what do you think are the ideal qualities that make up an excellent physical therapist? What are some qualities that you think they should have?
Oh, that's a good question. I think they need to be a good listener. I think they need to be objective, and I think they need to be smart. It's a lot of information that you need to know, and I don't think, you've got to be able to synthesize reams of information, and I think that some people don't always appreciate sort of the education that we really do have in medicine, the medical courses and so forth. So you do have to be a pretty good student to be able to achieve the degree, I think.
Yes.
But I think you need to be someone who likes people and is energized by that relationship. You don't have to be an extrovert, but you just need that, desire to work with people.
Yes.
And humanistic, You know, it's not it's the business of PT is certainly important, but it's like if you're drawn into corporate life, that's a very different kind of person than that would be drawn into physical therapy.
Yes, yeah, that's so true. And I think the part about listening to people, listening to patients, or listening to others around you, I think that's so important to just absorb. And oftentimes we're so engrossed in like wanting to teach something to our patient, but a lot of times they're already telling us something.
Right.
A friend of mine told me, yeah, Michael, did you know that you can spell out silent with the word listen? And I'm like, oh, you know, so I was just like, oh, sometimes it's better if I just keep my mouth shut and just let them tell me really what's going on.
Absolutely, absolutely. I mean, obviously some patients can run on and on and on, so you do need that ability to focus the conversation, but
Yes,
overall I feel like we need to talk less and listen more.
Now, this is a little selfish question for me because I'm approaching 40 years old soon, and I would like to know, what advice would you give to your 40-year-old self?
My 40-year-old self.
And kind of please tell us like what you were doing, where you were in your career.
When I was 40?
Yeah.
I was working part-time with 3 young children.
Okay.
And so at that point, I was really balancing my life with trying to continue to work and raise my family. And I would try to leave at 3, and you know, I would try to keep my hours. So I had to say no to a lot of things.
Say no.
During that time because of that balance and that need for balance. And so, and I think every person is different. Some people really need to stay home and raise their kids, and some people need to work full time, and depending on finances, of course, but if you putting that aside for a second, just your personal needs. And so I really enjoyed working part-time. It kind of met but it was a balance for me.
Yes.
And so probably the one thing that I didn't do professionally at that time that I probably could have is get more involved in the sections, or in APTA, or the state, you know, just a little bit outside of my little WashU shell, because that's been such an enriching experience for me to be in the Orthopaedic Academy now, because I have met so many people from across the country and the world.
I bet.
And just opening your eyes to how other people are doing things. So I would say, even if it's just going to a few meetings or being on a committee, maybe attempt to broaden your life a little bit outside of just what you do at your job.
Wonderful. What do you envision ideally for the future of physical therapy? What kind of positive picture are you painting in your mind?
Well, since the vision statement has adopted the movement system, I mean, I feel like that was a day when the stars were all aligned, and something that my whole career I have been interested in movement. So for the APTA to embrace that, it was just so exciting. And so I'm just thrilled that that's where we're heading, and I think it has so much potential for our practice, for our profession. And I feel like if we can become movement systems specialists in the way that are a little bit more consistent, you know, I think everybody thinks they look at movement, but when you really have a conversation, people are doing different things.
Yeah.
So I'm looking forward to us being independent practitioners, part of the team, you know, not a secondary level, but at a primary level, and really kind of the go-to person for advice on the movement system.
Great. And what's your current professional goal? Are there projects that you're working on currently?
A second edition to the book is that we've come so far in our analysis of the shoulder and the hip since the first book.
Okay.
That is a huge goal, is to get that. I really need to get started have gotten started and then stopped. So we need the publishers to kind of push us. But and I'm involved in the clinical practice guidelines for the non-arthritic hip population that's in process right now. So that's another goal is to get that work done.
Okay, great. And when are those 2 projects, like, do you expect them to be published out in the world? I get questions from people, it's like, are they working on the 2nd edition?
Yes.
You know?
The book, probably it'd be a couple of years, to be honest, I think, because I think we need to regroup, and I think we have the material. It's just a matter of getting us to buckle down and do it.
Yes.
So I think the content is there. We just need the process, and we need a little push. And then the practice guidelines are really, we're doing a revision right now of the first guideline. So right now we're just finished with the search terms and all that. So I think it could be probably a year before that.
I see.
But within a year probably.
Yeah, we'll look forward to seeing those coming out. Great. So now we're going to move on to some fun little questions, getting to know Nancy on a little more personal level. And it's been said that you are the average of 5 people that you surround yourself with. Now, who do you think your 5 people are who influence you the most?
Well, if I think about my personal and professional life, I'd have to say Shirley Sauerman, because I've known her for over 40 years, and she was instrumental in getting me started in physical therapy. And so she has been throughout my life just a personal friend and a mentor and supportive person, even when I was struggling with raising family. She's very understanding, you know, so she has definitely been a very big part of my life. My husband, who is with me all, you know, if not present, but with me all the time, and he is just a good friend and person to love, and he's very supportive of my professional career. He's, you know, not at all you know, jealous of my time or that kind of thing. So he's very supportive and a lot of fun to have around, and he's met a lot of people. So
that's right.
Yeah. So.
I really enjoyed meeting him, and it's so nice to have that family support where, you know, it's like, oh, go out and do your thing.
Right.
You know.
Right. And he does the same, and then we love spending time together. So that's always a good thing. And then I have a lifelong friend named Randy Costas, and we went to high school together. Okay. Some people call us the Bobbsey Twins. Because we're about the same size.
Oh,
and,
okay.
We have a group of high school friends, about 12 of us, who still see each other. And so Randy has been through, you know, except for my elementary school years, been like my best friend through a lot of thick and thin. And she is like my partner, sort of, in a friendship sort of way. And then, you know, I'd have to say collectively, 2 groups. One is my parents and my sisters, my core family. I have 2 sisters, and my parents just celebrated their 71st wedding anniversary this
so
week.
Amazing, so amazing.
Yeah, 92 and 91.
Woo.
And they are just the best parents. They've just been unconditional love, supportive, safe environment, taught me how to work hard, and just always let me kind of find my own path. They weren't, you know, you have to do this or you have to do that. So and my 2 sisters, and they couldn't be better friends and support. So they're just like, we're like one. And so that, my little core family.
That's great.
I still spend lots of time. Both of my sisters live in St. Louis with their families, and so I'd say that collectively it would be like a 4, and then a 5 collectively would be the children. So I have 2 stepchildren and 3 children of my own, and they say you're just as happy or unhappy as your happiest or unhappy child, you know, and they are part of your blood and your lifeline, and so I really do feel like they are just part of me.
Yes.
And when I know they're all doing okay, I just feel good. So I'd say those are my 5.
Wonderful. Now, Dr. Shirley Sarman has also named you one of her 5 people that influenced her the most. And of course, as you said, you've known her for many decades. Can you describe Shirley in a few words and maybe share with us some of your most memorable moments with her?
That's hard to do, as far as not to share memorable moments, but to put 3, only 3. I probably will cheat and go to 5 or something.
That's fine. That's fine.
But she, I think when you first meet Shirley, you are immediately aware of her intelligence and keen sense of observation. I mean, she's very bright, and she can read an article and remember it 10 years later, in a way that I don't know anybody else can, Very bright person. And she would be upset with me if I didn't say she was funny, because she she definitely is funny, but she thinks she's funnier than probably anybody else thinks she's funny. But that is definitely true. She's tenacious. She worked hard in graduate school. Didn't come easy to her. She kind of was a pioneer in that time, and worked really hard, and always is questioning. So academics was a good fit for her, and so I think she's very tenacious, and then probably on a more personal level, she is just the most generous, supportive, loyal. I'm going to start crying.
Yes.
Friend that you could have.
Yeah. Absolutely. And
a funny thing would be when I first met her.
Yeah.
She had a patient who did videos, and she said, "I can't learn these exercises. I would like for you to make a video. And wouldn't your patients benefit from videos?" And I said, "Oh yeah, that's a good idea." And she said, "Nancy, would you help me?"
Yeah.
And so this lady came to the little lab, and she had her video, and she wanted to do a dry run on what we would do. So I took dancing lessons for many years, and so I had a lot of costumes. And so I showed up in a sequence outfit with a little feather in my hair.
Oh, nice.
To see if that's what Shirley had in mind for the video. And I barely knew her. So for me to do that was kind of bold, but it was funny.
That was a good
so
one.
we had a good laugh about that one. And then just over the years, we've been going to Italy to work with our colleagues over there, and just those long international flights.
Yes.
And just the laughter, and the richness of that. Those have been some really very special times.
Yeah. She's a great storyteller. I just want to just keep writing out all the stories that she shares with me.
Right. Yeah. And her energy, holy cow, all over the world still.
Non-stop.
I couldn't keep up with her.
She told me this year, Michael, I have 8 international trips.
I know. She'd go from Hawaii to Italy in like a week. It's crazy.
And she'll be sure to take the red eye so she can come back to St. Louis in time.
That's right. And for somebody who lived in her foundation in St. Louis is probably a square radius of 5 miles, where she grew up, where she went to high school, where she lives now. I mean, she could probably walk to all of them. And yet she's worldly.
She is worldly.
Yeah. She's this little tiny nucleus in St. Louis, and then this worldly life she lives.
Very good. And next up, do you have a favorite motto, Nancy?
Well, you sent me this list of questions. I thought, I don't know if I have a motto or not.
But it's okay.
But as I thought about it, I think probably one thing that I live by is do unto others as you would have them do unto you. So I try to treat other people like I would like to be treated. So that kind of guides me in relationships.
Good one. Do you have a morning routine? What does the first 60, 90 minutes of your day look like?
I'm a morning person, so I usually have my best ideas and productive time in the morning. So I like to get up early, and I like coffee, so I'll make a pot of coffee and have a cup of coffee. And I usually get ready for my day. Sometimes if I haven't done my emails from the day before, I'll do my emails,
Okay.
or if I have to prepare a document, that's my energetic, high power time.
Yeah.
And it's usually quiet because nobody else is up,
Mhm.
and so I get a lot done in the
Yeah.
first 90 minutes of the day.
Very good.
If I had my druthers, I'd also exercise
Mhm.
in that amount of time, but I
Mhm.
don't always get that done until later.
What time do you usually get up?
5:30 or 6.
Yeah, that's early.
Yeah,
Mhm.
mostly 6, but
Mhm.
sometimes I know that little extra half hour
Mhm.
helps.
Right, right.
But I'm
And-
much more like after dinner, I could bake cookies or something, but
Mhm.
I'm not gonna write something.
Yeah, it's that your brain power is on first
Right.
thing in the morning.
Yeah.
Yes.
Yeah.
Yes. Yes. And can you share with us about some books that you've enjoyed the most? It could be fiction or nonfiction.
Yeah, I love to read, but I have to say I don't read that many books except when I go on vacation. Just because you're reading journals and this and that, I don't typically, and I fall asleep the minute I start, because I usually would read at night and then I'm. But recently I read All of the Light We Cannot See by Anthony Doerr. It's placed in World War II. In the invasion of France.
Okay.
And last summer, my husband and I went to Normandy, and we visited Brittany and Normandy, and learned all about the invasion. And so this book, I read that, and it was fiction about
Historical fiction, okay.
a French girl who fell in love with a German. She was blind, and a little German boy, and so it was a great book, but also it set the stage for where I was going for my visit. So I would say I like historical fiction, and otherwise I like good spy books.
Yeah. Okay.
Yeah,
Okay.
like if you're at the airport and you just pick up some trash thing that you read on the airplane.
Oh yeah, they sell a lot of those good books. And let's see, what are your favorite exercises to do for your fitness and health?
Well, I go to the gym, not as much as I should, but when I'm there, I do weight training. So I try to do upper and lower extremity things that I think are safe. And I like multitasking with my weight training. So,
Oh, okay.
So doing things that maybe I'm doing a lunge while I do a deltoid,
Oh, okay,
something like that.
Yes.
But I like to. My husband is a good runner, so sometimes we run together.
Go running.
And if I don't run, I'll do something like the elliptical.
Mm-hmm.
So I mix it up. I like variety,
Mm-hmm.
but I really much prefer sports like playing tennis or something where I'm engaged in the game
Yes.
than the workout. But so I try to do a combination.
Yeah. And you hit great this morning.
Yeah, we did have a fun time.
Totally enjoyed that hour. Thank you so much for elevating my heart rate for quite a lot. Did you play a lot of different sports growing up?
Well, I danced.
Yeah.
My whole life I was a dancer. I did ballet, tap, jazz, and toe, and acrobats.
Acrobats too.
Yeah,
Wow.
yeah, flips and cartwheels, and I was a cheerleader.
Okay.
Um,
Okay.
And then in high school, I played whatever the season was. I sort of just played field hockey in the fall, or I played basketball until everybody got taller than me, and then I became a cheerleader.
Okay.
And then I played some tennis in the spring. So I just did mixtures of things when I was growing up. But I played field hockey in college, and I love that. And then since college, mostly just more adult forms, because you can't really get a field hockey game together. So more like the tennis or.
Now, field hockey is very popular in the East Coast.
Yes.
Right.
Yes.
But did you go to school for college in the East Coast?
Yes.
Yes.
I went to University of Virginia.
Yeah. I think it may have been Shirley who told me that you were one of the first women who got accepted to go to
Well,
University
it
of
was, they
Virginia.
had just turned co-ed. It's a state
Yes.
university, and
Yes.
in the state of Virginia, Mary Washington was the girls' state university, and University of Virginia was the boys'.
Oh, okay.
And so when I went to college, they decided they were going co-ed. So the first couple of years, they just took some. They had like a graduated
I see.
program.
Okay. Okay.
And so I was in that first group. So there were lots of boys and and a few girls.
That's great. That's great. And you've mentioned your trip to Normandy. You probably traveled around the world, both for leisure and to also go to conferences and teach and things like that. But do you have a favorite city that you've visited?
I'd have to say I love Italy. And gratefully, I spent a semester in Rome when I was in college.
Okay.
And so I've always had a heart for Rome. But through our relationships with these wonderful Italian colleagues, I've been really all over Italy with them. And one city is as fantastic as the next.
Sure.
So I'd have to say that's top. And Marcy Harris-Hayes and I were just in Zurich and Bern, and I'd have to say that was really
Nice
special
too.
as well. Yeah.
Great. And what about, where would you like to go next that you've never been before?
Japan.
Japan! Did you guys hear that? Well, I can make that happen for you.
Yeah, no, I think Japan would be cool, but I also think Sweden would be cool too.
Yes, yes, yes.
There's a lot of interest in the movement system in Sweden.
Okay, great.
So that would be kind of fun.
It's one thing I remember walking in the streets of Stockholm is that even though it's a very cold country, right, I visited in the summer, there's like an ice cream shop at every corner. They love their ice cream. Yes.
Oh, that's interesting.
So make sure you have your ice cream or anything dairy because everything was delicious.
I did teach a course in Reykjavik in Iceland. And I went the day before. I signed up for a tourist where I saw all the natural wonders of that area. That was really a special.
Beautiful.
If you've not been to Iceland, there was a music festival going on.
Okay.
And I also went to the Blue Grotto on my way to the airport. So you go and jump into this water. It's January. It was freezing.
Okay.
But you get in this Blue Grotto water, which is like a carved out lava, area.
Okay.
So the water's very warm.
Oh, I see. Okay.
Everybody's got like spa things on their face, and you look like Indians, with war paint on, and you're just kind of swimming around.
Wow, that's quite an experience.
Yeah.
Awesome. Okay. And just fun questions like, do you watch any like TV?
I don't watch that much TV, but I do watch TV in the evening sometime, and I like, sometimes we just tape shows because they're never on exactly when you want. So a lot of times, so when we watch them together, we watch certain shows. When I'm by myself, I watch certain shows.
Okay.
So like when my husband and I watch TV together, we watch a lot of the HBO kind of series kinds of things. But when I'm by myself, I do watch The Voice.
Oh, The Voice. Okay.
I know my husband is totally uninterested in that, but I tape it, and then I like it when I'm making dinner. I can kind of listen to The Voice.
No, I wanted to kind of hear, some of your guilty pleasures.
Yeah,
so.
All in the Family. I like that one.
Okay.
And
Okay.
some of the housewife shows, I do those once in a while.
Yeah.
They're pretty bad.
Yeah. And what kind of music do you? I mean, with your dance background, dance, performance, music. What type of music do you enjoy?
I really like all music. I really do. I mean, I probably wouldn't like super electronic, hard rock kinds of stuff. But other than that, I just really love having music on, and depending on your mood or what you're doing, a quieter version or a
Sure.
But I really don't have a particular favorite.
Yeah. I like to put on some jazz type of stuff. It's just when I'm doing my reading or trying to study or come up with some slides, just to kind of get
calm.
me going. Yeah. So last question: where can people find you on the internet or social media? Is that possible? And or just to find out where is your next course?
Probably, I am on Facebook.
Mm-hmm.
So that is probably one of my more expanded social media efforts. And my friends the other night were telling me I need to do Instagram, so I haven't done that, but maybe I will.
Yeah.
But I can always be reached for email.
Email. Mm-hmm.
Yeah, and the university has my email if anybody ever wants to contact me that way.
Okay.
So that's probably the best way.
Uh-huh. All right. And just to share with you guys, in August of 2019, this year, I'm inviting you and Dr. Sarman over to Los Angeles for our movement system seminar course. We'll cover the lumbar spine, hip and knee, and it's sort of a combination of a lot of Japanese professionals coming over to Los Angeles, and then we'll have some local therapists join us too. So we look forward to having you in LA and learning from you. So yes, thank you so much today for your time, and learned so much about you.
Thank you.
All right, we'll see you later this summer.
Yes? Okay, sounds good.
All right, thanks.